I had been actually seeing Dr. Michel for some other things about once a year, and so he started tracking my PSA, and started to see a little bit of elevation, starting to increase a little bit, and tracked it over probably a year and a half periods of time, and decided that it's continuing to elevate, and we ought to, take a look at it and do a biopsy. And it was not, my PSA was not even that high. As a matter of fact, I went to my regular doctor to get, get checked out before I had my biopsy. He said, "Why are you even looking at this? I mean, your PSA is not that high." And so, so I really attribute Dr. Michel tracking the velocity and being concerned about that and watching that to really alerting me to the fact that I really had to take a look to see if I had cancer or not. So I did biopsy, and yes, I did have cancer cells, a significant amount. But he did catch it early, which I'm very, very grateful for. And so he went through all the different kinds of procedures that could be done, and it was real clear that doing a prostatectomy was the right thing to do, and robotically assisted, which the process he used was the state of the art, and I did a lot of research on it. And I'm an engineer, so I researched all the various ways of taking care of it, and it was clear that his logic really was the right way to go. And so did the surgery, and that went very smoothly. He made me feel very comfortable through the whole process, that everything would be okay, and don't worry about it, and matter of fact, if anything, look at this as kind of a change of life, into the future, and so use this experience. And so so it was all a very positive experience. And so I had the surgery, and it went extremely well. I decided to do it pretty quickly. I have a major conference that I'm one of the major organizers for that I decided to forego. It was coming up pretty quickly, and I would have had to put off the surgery for a month, and I decided that I just want to get that prostate out of there. So went ahead right away, and I'm very glad that I did. And the surgery went extremely well. The process of using the robotic assisted surgery made it so that there was very little recovery time. I mean, I was back to work in about a week and a half. One of the benefits of doing it using this robotically assisted process is they're actually able to get in and do it very precisely, so they could really get around and spare the nerves, which is significant. The holes were just very small, incisions in your abdomen, so it's leaves very little scar tissue, and it healed up, quite quickly. In addition to, making me feel very comfortable about the surgery and all the options that I had that Dr. Michel went through with me, they also started me, kind of prepping early and doing things like doing exercises to make sure that I strengthen my pelvic muscles so that, to minimize incontinence afterwards. So I started that before the process. I've had other people who've gone through the surgery, and it's something that they end up trying to do afterwards. But I feel like the amount of prep and care was very important in getting rapidly back all my functions and my continence, which happened pretty rapidly. And also the aftercare was very significant in this office. I mean, they were taking me, doing a lot of training and helping getting the incontinence under control, as well as the erection function. It was something that they really put a lot of focus on, starting right away, trying to make sure that things get exercised in a way that maximizes, getting everything back into its original shape, which actually has happened. So I feel like they not only worried about getting the prostate out, but they took very seriously the issues that occur with the surgery, and that is incontinence and also, you know, the erectile dysfunction possibilities that can occur, and they were very aggressive at trying to make sure those side effects were eliminated. Right. And very successful with that. And so I was very pleased with that as well.